Guys, my name is Dr. Huzaifa Salim, and I am GMC registered doctor, and I am mentor at ProMedic e-learning platform. Uh, this platform is providing you with this free webinar in order to help you guys understand. I know when I was about to start my MRCP journey, it was like I was totally clueless. I had no idea what MRCP is, what if I will pass my MRCP, where I will stand, what job I will gonna get. Is it worth it? Should I go for it? What are the paths? What are the study materials out there? How much is the fee? How much it will be heavy on my pocket? A lot of questions. So, guys, this session has been arranged to help you clear all of your queries so that you can start your MRCP journey with a very, very clear picture, and you should have a very clear picture that what MRCP is and what you will gonna get out of it. So uh today I'm gonna help you understand what is MRCP. I will go into brief detail of uh the parts MRCP 1, 2, and PACES. Our major focus will be on MRCP 1, okay? Because this session has been arranged in order to make things easy for those people who are about to start their MRCP journey and they are aspiring for MRCP 1. So guys, so I will be going into detail of MRCP 1, whereas I will be touching very concisely on MRCP 2 and PACES. It's a very big domain. I'm going to touch it. I'm going to tell you what exactly PACES is, which is the third part and the clinical part of MRCP journey. And but we will not be going into details of that PACES part because that's not our topic today. Okay, so then later on in the second half, I will be giving you a presentation on certain topics from pharmacology for MRCP part 1, just to let you know that how you have to study for MRCP 1. Guys, I'm just building the base right now so that it's easy for you guys to understand things. So the the lecture portion, the lecture part will be very, very concise, and my main focus will be on how you have to study for MRCP. Guys, you always have to study smart for MRCP. No doubt, hard work is there, but smart study is very, very, very important for MRCP because the amount of knowledge you have to retain, the things that you have to retain for your exam, it's like very vast subject. MRCP is a very, very vast subject, guys. You don't know from where you will gonna get the question, how you will gonna get the question. At the end of the day, when you are sitting in the examination hall, the only thing that will gonna matter is your smart study, that how you have grasped the topic, how you have studied that. If if a question from this topic will gonna come, this is how it will be coming in the exam. There are certain key points. There are certain important grasping points which are very important for you all to learn, that how to study, how to make your life very easy, and how to pass your MRCP in first attempt, guys. Passing MRCP part 1 in first attempt is very important because there are multiple factors, guys. First of all, time. You all know time is money. Time is money, guys. Time is running very fast. And with the increasing competition and the competitive market out there, guys, it's like we all can't afford to fail and to sit in the next diet, which will almost take. Okay, guys, I'm really sorry for the interruption, and we will be moving forward. And let me just please wait a second. So, guys, let's start. Today's agenda and objectives are: what is MRCP? steps of MRCP exam, structure of the exam, how to apply for this exam, available exam centers, preparation resources, how to pass in first attempt, a small presentation and a very concise presentation from certain topics from pharmacology. And later on, at the end, I will be presenting to you guys some past questions from those topics which I'm gonna deliver or teach you right now after some time. Then we will have an open discussion, question and answers. Don't worry, guys. In between these agendas and objectives, still I'm going to help you guys, and I'm going to give you time to ask you your questions. So don't worry about that. Okay. So guys, the next important thing I'm going to tell you is that let's start in and let me tell you about MRCP. MRCP is membership of Royal College of Physicians of United Kingdom, guys. Okay, so it has three parts. Part one, part two, both are written exam, MCQs based questions, which are being held throughout different centers and countries in the world. And you can take them in person, going to the examination hall, or you can sit in the exam online as well. Okay, and the third part is the clinical part, which is called PACES, practical assessment of clinical examination skills. First two parts are written, MCQs based. Third part is totally clinical. It will be about patient, and you're dealing with the patient, how you approach the station, what you will gonna do there, your ethical, your communication skills, your ethicals, your ethics, your clinical skills, your communication skills, and your interpersonal skills, every single thing will be assessed in PACES, guys. But part one and part two, they are written exams, and the part three, which is the PACES, it's a clinical exam. So first question most of you guys will be having in your mind is that, what if we will gonna pass MRCP, where we will gonna stand? So guys, let me tell you that, okay, guys, I'm really sorry. There was some technical issue. Anyways, so guys, first of all, MRCP exam, I guess most of you guys who are here, they are outside. They are not a trainee in the UK. I am just assuming maybe there is someone from the UK as well. So guys, first of all, the thing is that this flow chart, which has been shown here, it is for the people who are working or training in the UK. Okay, there you have foundation year training for 2 years, foundation year one, foundation year two. Then what you have to do is that you after that you have to get your competencies signed. There is a criteria to get into the training. Then you will go into the internal medicine training, IMT, which is of 3 years, guys. So in those three, I'm just telling you for the UK, and later on, I'm going to tell you about like international medical graduates. So MRCP UK, you have to complete all three parts. You have to complete all three parts. Um, yeah, thank you. You have to complete all of the three parts, full diploma for MRCP, until you have finished your internal medicine training of 3 years. Only then you will be able to go into specialty and stage two, guys. Okay. Then uh, for international graduates, okay. So guys, the next thing is that for international medical graduates, what will happen is that for if you will gonna go for MRCP, there are multiple advantages for that. First of all, let me tell you that if you are a newly graduate, you have done your house job, only then you are eligible for going and sitting in MRCP part one. House job or 12 years of post-graduation experience. Post-graduation is, I'm not, it doesn't mean that post-graduate mean that you have to go for MS, MD, something like that, FCPS. No, 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 no. Post-graduate mean that after your MBBS, your house job is of 12 months, 1 year. That's enough. You can go and sit in MRCP exam. Then later on, if you have done your MRCP, you don't have to go for PLAB for GMC registration. If you want to go work in UK, you don't have to go for PLAB. MRCP UK will help you get GMC registration. And MRCP UK will gonna help you get a middle grade job, guys. Middle grade job mean registrar job. It's a non-training post, and registrar, ST3 basically it's called in UK, ST3 job, middle grade jobs. Guys, maybe I know all of you are interested in pursuing your careers in the UK, and I know that most of you will be worried about the saturation, about the saturation that is going on right now in the UK market. But let me tell you, middle grade posts and the consultant posts, there is a big loophole, a big, you can say that uh, there is no one to take those posts. So doing MRCP will gonna help you get the middle grade job right away. You don't have to go and start your job on a junior clinical fellow or foundation year 2 fellow like that. No, 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 no. You will gonna go and get the job at middle grade directly. Then, second thing, MRCP UK is recognized in most of the subcontinent. It is recognized in Middle East, and you can work as a medical specialist there. Second thing, guys, this degree, this diploma, it's worth it. It's like a star in your CV, guys. It's like a star in your CV. And if you are already on a track of doing PLAB, and you are done with your PLAB 2, and you are done with your GMC registration, and you are looking for a job, but because because of some reasons you are not getting the job, and you have applied for multiple applications, maybe 100, 200, something like that, guys, while applying for the jobs, please go for the Royal College Physicians exam. They are really, really important exams. If you have done MRCP 1 and it is being reflected on your CV, let me tell you that your chances for getting the job in the NHS are gonna go high. It's very simple, guys. They really, really, they are always looking for candidates. They are always looking for candidates who are going for MRCP exam, guys. But let me tell you, guys, very, very common misconception is that everyone have to give this MRCP exam. Like, for example, if you want to go and work in a psychiatry in the UK, you don't have to take MRCP, guys. You don't have to take MRCP. There is MRCP psych for that. If you want to pursue your career in emergency medicine, there is MRCEM. MRCP is for the medicine. If you want to go in acute medicine, if you want to go in internal medicine, if you want to go pursue your career in cardiology, in gastroenterology, in endocrinology, in the fields of in all the subunits and subcategories of medicine, then you have to take MRCP, guys. Okay, because no one will gonna tell you about that, and all of you will take MRCP, and they will gonna think that it will gonna help you get the job in the NHS. But later on, maybe someone of you, maybe most of you, they are not interested in medicine. You guys want to go in emergency medicine. You want to go into in pathology, in dermatology, like that. So, guys, there are different exams for different. Maybe someone wants to go to pediatrics. So there is a different exam for from Royal College of this pediatricians. Okay, MRCPCH. So, guys, please, first of all, you and a very, very humble advice to you guys, that if you love something, if you love certain field, only pursue that field, guys, because it will gonna stay with you for the rest of your life. Don't just think that this job or this specialty is less saturated, but I'm not interested in it. But let's just go into that specialty and get a job. No, you will not be happy in the long run. Please pursue the career in which you are happy, the thing that you love to do. I just love medicine. Okay, I just love to read medicine. I just love to teach medicine. So that's why I am pursuing my career in medicine. So that's what I will advise you guys first and the foremost thing. Okay, a lot of discussion has been done. So let's go into MRCP1, guys. MRCP1, it's an entry-level exam. And I have already told you, you need 12 months of postgraduate experience, which is a house job, experience, guys. It's enough. If you have done your house job, that's enough. Then it's a one-day exam, 2 papers of 3 hours, total of 6 hours, guys. First paper will be 3 hours, then you will gonna get a break in between around 45 minutes. Then after that, you will gonna get a second paper, which will be paper 2. And the second paper will be of 3 hours, a total of 6 hours. It's a very lengthy, very tough exam. To be very honest, I'm not demotivating you or degrading you guys. No, I'm just telling you that it's a really tough exam. First of all, the thing is that we have uh, every one of us, cannot pay the hefty fee, the amount for this exam. Secondly, we know that nowadays time is very important. Third thing, you are sitting in the examination hall under the exam conditions, under the pressure of time, and you have to be so vigilant and active mentally and physically that you are reading the statement and immediately it should click in your mind that, okay, this can be the answer of this, because the exam is so confusing. If you have studied smartly, if you have done a smart study, you are 100% pass in this exam. 100 multiple choice question in each paper, a total of 200 MCQs, guys. A total of 200 MCQs. 100 in paper 1, 100 in paper 2, a total of 200. And every MCQs will gonna consist of 5 best options. And let me tell you guys here, 5 best options, like it doesn't mean that that one option will be the answer and the rest options will be like out of the blue. No, all 5 options will be very, very closely related. They will be from the same topic, but one of them will be the best. This is what makes MRCP a confusing and a difficult exam, because you will gonna sit there and think, oh my God, I have read this option as well in this topic. I think this is the answer. Then you will gonna read the second. This was also there. Third one, oh my God, this one was also there. What is the answer? So guys, there will be a certain catching point, a certain important point in the question stem, which will gonna help you to choose the best answer. And that is how I'm gonna help you. I'm gonna tell you how to study for MRCP while doing your job with less period of time, spending less energy, less time, and how to study smartly and how to pass it in first attempt. I have already told you it's a computer-based exam as well as in-person paper and pen exam. Important and good news is that there is no negative marking. So please solve each and every question no matter what. Even if you know the answer or not, just go and pick the answer and go with your instinct, go with your gut feelings, okay? And don't leave any question unattempted, please. And it's a pass or fail exam. That means that it's like, though there are marks there, like for example, someone will gonna score 600, someone will gonna score 700, but that doesn't matter, guys. It's if you are pass, you are pass. If you are fail, you are fail. Okay. Like before in USMLE, like your scores matter, but now they have also changed it to pass fail, something like that. Similarly, MRCP exam is like pass or fail. It doesn't matter that, though no, I'm not telling you that don't go for high score. If you're gonna score high, when there will be the convocation at the Royal Colleges, you will gonna get a gold medal if you will gonna score high. But still, if you are pass, you are pass. Even if you are pass with 1 mark, you are pass. Or unfortunately, if you are fail with 1 mark, you are fail. Even I have seen candidates failing with just 0.5, maybe something like that. Their score is 0.5 or once, like less than the passing score, only 1 mark less, and they're failed. So how heartbreaking it would be, guys. You can imagine. And you can see here in red, passing rate is only 30 to 40% for MRCP1, guys. Only 30 to 40%. See how less the passing rate is. Because you need proper guidance. You need you guys need a proper land map, so that you should know how to study for MRCP, what is important, what is not important. There are hundreds of things out there in the world, open world. Everyone will gonna like most of the people will gonna tell you, read this, study this, don't do this, don't do that, like this, like that. This is the material you can use, this is the material you should use, this is the book you should read, this is the question bank you should read, guys. But the important thing is here, that the important thing is that how you have to study. If you will not be able to revise your material, if you are not able to revise your whole syllabus or course, it's what I can give you guarantee that you will not be able to reproduce there in the exam, because in the exam you will not be able to know that from which topic the question is coming from, because they will gonna make the question like in a way that it will be a combination of different subspecialties. Like, for example, let me give you an example. Guys. Okay, so if they will gonna ask you something about a drug, they will gonna tell you that a patient is taking a medication from the heart, a patient for some heart pathology, a patient will gonna is taking medication for some for maybe some COPD, something like that. So they will gonna merge different topics. They want to test your knowledge like in depth. So they will gonna ask you questions. There will be some questions that will be very straightforward. Everyone will be able to answer those questions. There will be some questions that will be, you can say that in a mid-range, and there will be some questions that will be difficult. And let me tell you, every single question matters. I have told you that I have seen candidates failing with 1 mark, 0.5 mark. So every single point matters, guys. Okay, so the total passing mark for MRCP part 1, approximately 540, guys. Approximately 540 out of 999. I know you will be having a question in your mind that the MCQs are 200, how the marks are 999. So guys, actually it's a marking criteria, an equivalent type of marking criteria on which they have certain software or something like that. They just put the questions in those in that thing, and it's an equality mark, like how many candidates have attempted this question right, and how many have attempted this question wrong. So according to that, there is a certain percentage for each mark, and according to that percentage, they will gonna score you. Okay, maybe if you have, let me give you a simple example of that. If you have answered an easy question, the weightage of that will be less, because most of the candidates would have answered that question. But if you have answered a difficult question right, and maybe 50-60% 50-60% of the candidates have marked it wrong, you're gonna get a better score in that. It will gonna improve your score. So this is how the marking works in MRCP, guys. 2024 diets. Diet means that the attempt, the exam. Actually, we call it diet. Okay. So 4 diets in a year. We are already done with the April one and January one. Now we are aiming at August and October. Okay. So guys, the thing that I was telling you, that it's very important to pass in first attempt. As you can see, if you will gonna see, these documentations have been taken from the official website of MRCP. If you guys can, if want to see, you can go and search MRCP UK, and you can get all of these information there out there. Okay. And the dates and everything. And I'm gonna tell you that how you will gonna, if you want to book your exam, how you will gonna book everything. Don't worry, I'm gonna tell you each and everything, and I'm gonna try to make your life easy. So the thing that I really want you to focus here is that, if you can see, guys, there is this application period. The first thing, application period, guys. You can see there is a certain time frame or time window in which you are able to book your exam. For example, just focus on the first one, the application period 6 November to 13 November. Okay. But the exam is on 24th of January. And if you can see the result, it is it is by 23rd of Feb 2024. So the point I want to prove here is that the result of the diet is on 23rd. But in the next diet, you can see 2024 by 2. Application period is from 5th of February to 12th of February. So you can see, guys, that if unfortunately, if someone fails the exam, he will not or she will not be able to book the immediate next diet, because the time window has already been passed. Your result is on 23rd of February, but the time window to book the exam has already been closed. So guys, you will be able to book your next exam after 6 months. Oh my God, 6 months. See, this is why it is important to pass your exam in first attempt, because we're like 6 months, 6 months, guys. It's really difficult to explain that how important the time is. So please plan your things accordingly, study accordingly, study smartly, so that you are able to pass your exam in first attempt. You will be saving your time. You will be boosting your confidence. You will be saving yourself from a hefty amount of fee you will be paying for this exam. Guys, you can see international graduates, international candidates have to pay 616 pounds. 616 pounds. Big amount. We all know, with the ongoing inflation in the world, and job crisis and everything, uh, I don't know that I know actually that it's very difficult to manage things, to take out fee for the exam. So I really want all of you guys to pass it in first attempt, because it's a really expensive exam. Different examination centers held all over the world outside UK, and whichever this center is suitable for you, you can book your seat for that. Okay, now the important part, application process, how you will be applying for it, guys. The thing is that, first of all, you will gonna go on MRCP site, and on the right upper corner, there will be a small icon of My MRCP. Select My MRCP, make your account there, okay? Fill all your details, everything, your name, your address, everything, whatever they will gonna ask you, just fill it, make your account. Then you will gonna proceed on to the next window, and it will gonna ask you for the center you want to sit in, okay? For the center you want to sit in. Then you will be selecting your center. Later on, you will gonna pay the fee for the exam. Once you have submitted the fee, you will gonna get our RCP code on your email address. That RCP code is particular, or it is specific code for you only. everyone who is or who has already booked the exam, or who people or guys who are already done with MRCP, they have their own particular RCP code. Okay, it's like a roll number, maybe something like that. Okay, RCP is Royal College of Physicians. Don't worry. So the next thing that you have to do is that once you will gonna get your RCP code, you have to send your degree. You have to send your degree, guys. Primary medical qualification means your degree. Okay, with your RCP code attested by FRCP consultant or by any notary out there, you can get it attested, and you have to email that back to PMQ, which is primary medical qualification at the rate of mrcpuk.org. They will gonna confirm that you have already completed 12 months of your what you call it postgraduate period, and you are eligible for this exam, and you are a doctor. So exam format, I have already told you that 2-paper format, five best answers, 100 questions in each paper. Okay, if you can read the second paragraph, the 4 distractors are closely related to the preferred option but less correct, guys. They are you can see I have taken this thing from their website, from their official website. It's saying that they are less correct. They haven't mentioned that they are incorrect. Okay, so this is what is important to understand before studying MRCP, that everything will be very, very closely related. Only one answer will be the best one. So you have all of these distribution and breakdown of the number of questions which you will gonna get from each subspecialty. And let me tell you guys that these numbers, they are not authentic in a sense that these are approximate number. Okay, it's just an indication that this much question you can get, but maybe you will gonna get 16 questions from cardiology. It is written here 14, but maybe you will gonna get 16. Maybe you will gonna get 10 questions from dermatology. Here it is written 8. So guys, I know you will gonna be reading, and you will gonna be going through this table, and you will gonna be thinking that, okay, I can see that there are only 4 questions from medical ophthalmology, and there are only 4 questions that are gonna come from palliative medicine. So I think I can skip these parts. You are wrong. I'm really sorry to break your heart that you cannot skip any of the portion. Why? Guys, let me explain it to you. Whenever you will gonna get your results for MRCP part 1 or part 2, down there, they will gonna tell you that you have scored this much percentage in cardiology, you have scored this much percentage in pharmacology and therapeutics, you have scored this much in hematology, and so on. And so every single thing they will gonna tell you that this is the percentage you have scored in this particular subspecialty. So guys, let me tell you that if you will gonna get 14 questions from cardiology, so 14 questions will gonna make 100% of cardiology. But if you will gonna get 4 questions from ophthalmology, you will gonna be having 4 questions, and 4 questions will gonna make 100%. So guys, just see, if you will gonna answer 1 question wrong from ophthalmology, 25% gone. That is how they have designed the exam. That is how they have designed the exam, guys. So you cannot skip anything. You cannot skip anything. The questions, and especially these minor subspecialties, ophthalmology, psychiatry, palliative medicine, their questions have higher weightage. So you cannot skip them. And let me tell you that if you will gonna answer these questions correctly, your overall score will be high, because you will gonna get more percentile equivalent for ophthalmology's 4 questions as compared to cardiology's 14 questions, or 15 questions from pharmacology, or 14 questions from endocrinology. I hope that makes sense. Okay, guys, now a small break for you guys to ask me questions regarding this section. If you have any question, raise your hand. If you have any question, type it in the comment box, and I will try to answer that. So please. Okay, so guys, you can unmute yourself. You can unmute yourself. If you want to ask question, please raise your hand, unmute yourself. Guys, listen, I am trying to help you guys here, and I'm trying to make things easy for you. First of all, maybe Dr. Asia has asked the question that it was supposed to be a pharmacology section. So, Dr. Asia, I'm really sorry that we haven't yet started the pharmacology session because not everyone here is fully aware of MRCP. So I have to go into a bit of detail to try to make them understand that what MRCP is, and then we will gonna go on to the pharmacology section. Maybe you are already preparing for MRCP and you know what MRCP is, but most of the candidates, our session is for everyone. Okay, so please, just bear it with me, please. Okay, so the next question is past medicine enough for preparation? Guys, I will be going into details of the study material. Don't worry, guys. I will be going into details, and I'm going to tell you that what is important, which study material you should use. Just be patient a little bit, and just go with whatever I'm trying to tell you, so that everyone can benefit from this session. What's the difference between MRCP GP or MRCP? Okay, MRCPI is MRCP Ireland, whereas MRCP GP is if you want to go into practice for MRCP GP. There is a separate field for GPs in the UK, so you can go for that MRCP GP guide. OET is necessary for this exam. OET is only necessary if you will be taking your PACES exam in UK, or if you will be going to get GMC registration. But if you will gonna take all of the parts outside the UK, OET is not required. OET is only required once you want to get registered with GMC, or you want to get job in the NHS, or you want to go to the UK for this basis. Okay, guys, no problem. You can write your questions in the chat box. I will gonna be answering that. Which is better, revision notes, past medicine or past test, sir? Just bear it with me, doctor. I will gonna tell you which study material is better. Is it necessary to get training of Ireland after MRCP Ireland to move into specialty training of UK? Guys, MRCP is, I told you that for the international graduates, once you are done with MRCP, you will going to get a middle grade job, which will be a non-training job. And after that, you have to fulfill a criteria. There is criteria to get into the training. Okay. I'm telling you about MRCP UK, guys. Okay. But in Ireland, if you have done your MRCP 1 and MRCP 2 UK, I have seen candidates getting the training job in the Ireland. If you have completed your MRCP 1 and MRCP 2 UK, and you are not done with your PACES, and you want to go to the Ireland, I have seen candidates getting into the training job in the Ireland with MRCP 1 and 2 UK. Okay. Is the MRCP part 1 or 2 give you opportunity? Wait. Opportunity to work in the UK. Guys, no. MRCP part 1 and part 2, no, please no. You have to have complete MRCP along with PACES and OET to work in the UK. I'm in the UK. What are the requirements for MRCP part 2? Guys, you cannot take MRCP part 2 unless you have passed MRCP part 1. First, you have to go for part 1. Then you have to go for part 2 written. Then you have to go for part 2 clinical, which is PACES. That's how things work. Is it necessary to write IELTS for international students? No, for MRCP, if you are taking MRCP outside the UK and you are not willing to go to the UK and getting GMC registered, you don't need IELTS. The second option you can go for is OET. Is UAE is providing training for PACEs. Guys, PACEs, training for PACEs, there, let me tell you, let me make things more clear for you guys, is that PACEs, it's not like you need training to get and go for the PACEs. You have to be clinically sound, you have to be ethically sound to pass the PACEs. After PACEs, if you want to do training, you have to go to the UK. In UAE, training is not being given on the basis of your PACEs. No, they have their separate NCLEX exam if you want to go into the training. So no, that answer is no. Then how many year will be exempted if we registered ourselves with GMC through MRCP? Guys, if you will be registered in with MRCP, I'm telling you that it depends on what, mostly all the candidates who are already done their MRCP, they usually get registrar level job, which is ST3. So what you will be exempted from foundation year 1, foundation year 2, ST1, ST2. You will directly go into middle grade job, which is ST3. What is the job condition in UK? As I have heard that there is saturation on the junior level, even after getting MRCP, doctors are searching job in Australia and New Zealand as there is a lot of issues in NHS within UK. Guys, listen, the thing is that we have always been listening to these things, that job market is not good, people are not getting things. If you will gonna do things right, if you will gonna have your application presented in a better way, and you are MRCP, let me tell you guys, if you are already done with complete MRCP with PACEs, let me reassure you. I'm telling you about the middle grade jobs. You will immediately gonna get the job. But if you are not done with MRCP, you will have to apply for junior level jobs. Junior level jobs are saturated, and they are saturated for a long period of time. They're saturated for a long period of time, guys. So, but still people are getting jobs, still people are going. So please, it's not only about the clinical part or the academic, like MRCP part, that you have to focus on if you want to work in the UK. Guys, you have to do audits, you have to do research, you have to do teaching. Okay, if you will come across doctors from the UK with GMC registration, most of them will be doing teachings, most of them will be taking part in audits, because this is how NHS works. You will not be able to get appraisals if you will not gonna get if you will not gonna do audits. So it's very simple to do audits in your home country as well. There is no rocket science. There are a lot of videos available online on YouTube. You can watch the videos of Raja Adnan, Dr. Raja Adnan. He's a consultant psychiatrist. It's very easy to do audits. So it doesn't depend only on your MRCP that you will gonna get the job. People are getting job even without MRCP, guys. So there is no hard and fast rule. The only thing is that you have to be focused, you have to be patient, and just wait for the right time, keep on applying, tailor your application according to the job description and person specification. That's how things will gonna work. Any idea about specialty clinical exam? Yes, specialty clinical exam you can only take if you have already done your post, like specialty training. You will only be eligible after that, like FCPS, if you have done FCPS, if you have done MD, or if you are already done with 3 years of internal medicine and MRCP, 3 years of internal medicine and MRCP if you are in the UK. If I pass MRCP 1 this year, can I write MRCP part 2 after 2 years from the beginning of part 1? Can you expand and explain the answer? Okay, so guys, the important thing I will gonna tell you is that If you have passed MRCP 1, please do not delay it. Immediately sit in the next coming diet for MRCP part 2. If you don't have money, borrow it from someone. I'm telling you, the earlier you will gonna sit in MRCP part 2, more chances that you will gonna pass MRCP 2, because MRCP part 2 written is uh, it's almost the same as that of MRCP part 1, but a little bit more in depth of clinical knowledge, of clinical investigations and prognosis, something like that. But let me tell you, please do not delay it. Do not delay it. No, paces right now, paces, it's difficult to get before, but now things are getting better. Uh, it depends that when you're gonna get the date for paces. Paces is a totally different exam. It's a totally different scenario. So I'm only telling you about MRCP part 1 and part 2 written. Don't delay it, guys. That's the most important advice and take home message that I can give you in today's. Don't delay it. Don't delay it. Is it enough to work as consultant? No, guys. You have to be having complete MRCP and 3 years post MRCP training in the same role to work in the UAE. You cannot immediately pass MRCP and go as consultant or medical specialist in the UAE. No, you have to have MRCP complete with 3 years post what you call it 3 years of experience post MRCP in the same role. For radiology, is there a separate exam, guys? Yes, for radiology there is a separate exam in the UK, and it's a different field. So it's like the training pathway is different for that. What are the requirements for part 2 and paces? For part 2, your MRCP part 1 must be passed. You should have passed MRCP part 1. And for paces, both MRCP part 1 and part 2 should be passed. Before, people were booking paces before giving part 2, but now because of the backlog, they will not be giving you seats if you are not passed, if you haven't passed your MRCP part 2. Is there training required for paces, or you can give paces? Yes, there is no training required, guys. No training required. If you are doing training in your home country for MD or for FCPS, and you want to sit and it's not completed, no problem. Or even if you are working as a medical officer or SHO, something like that, no need. But your clinical skills should be updated, because paces is all about clinical. So the 4-year training process that is necessary for part 3 exam, these training years can be done in UAE, or we will have to go UK for those years of training. I'm sorry, I couldn't get your question. I'm sorry. Can you please just rewrite it simply so that I will be able to answer that? Without passing paces, can I get job in UAE? Guys, listen, this is not about UAE, okay? Without passing paces, can I get job in UAE with good pay? People without MRCP are getting job in UAE, and people with MRCP are not able, or FCPS are not able to get job in UAE. Right now, the job market is very saturated everywhere in the world, but keep on trying. If you have MRCP part 1, part 2, or complete MRCP, your chances of getting job will be higher, okay? Because it's a Royal College exam. It's exam from UK. So everywhere in the Middle East, in subcontinent, people will gonna love it. I have not done any audit yet. Should I spend my time more on audit or on study for MRCP part 1? That's a very difficult question to answer. To be very honest, I think you have passed your PLAB and you are registered with GMC. You are waiting for your job, and that's why you are asking for this, guys. This thing, Dr. Amna. So I cannot answer that question. I'm really sorry, because people without Royal College exams can get job in the NHS easily. Whereas people who haven't done even audits, they will gonna get job in the NHS. Guys, uh, I know doctors from subcontinent, from outside UK, we all struggle with these audits and research, but it's very important. It will gonna show that you are a all-rounder. You are a doctor who can teach, who can treat patient, who can do audits, research. That's why they are looking for a person who is an all-rounder. In UAE, no training how to appear part 2 paces. No, guys, you don't need training for paces. I told you that you don't need training. You don't need training. Can you please, what limited attempts for part 1 and what's changed they brought recently in this regard? Yes. Before it was that once you have passed your first MRCP part, within 7 years, you have to complete whole of the MRCP. Okay, but now they have changed. They have changed it. And the thing is that uh, the thing that they have changed is that they have removed the limit of years, 7 years, because people are getting the dates for paces a bit late. So most of the people were complaining that their MRCP is going to expire. They have to sit for MRCP 1 again. After COVID, there was a big backlog. That's why things have been changed. So the 4-year training process that is necessary for part 3 exam, this training year can be done in UAE, or you will have to go to UK. But guys, no training is required for PACES. No training, nothing. No training is required for PACES. You can sit even if you are working as a GP, even if you're working as a medical officer, even if you're working as an SHO outside the UK. Guys, but you told that post MRCP 3 year, guy, that was for the UK trainees. That was not for international medical graduates. That thing, that flowchart was for UK candidates. That flowchart was not for you. It was mentioned there. You can watch the recording again, and you can see there that I have written there that this thing is for medical graduates or trainees from UK, not from international medical graduates like that. What is audit? I'm really sorry, doctor. It's not the topic of our discussion today. It is something that you can search in YouTube or Google. Is MOship of 3 years along with clear MRCP enough to work as a consultant? No, not as a consultant, guys. You have experience of 3 years as MO, and you have cleared MRCP. Then in Pakistan, in India, you can work as a consultant. Yes. But in UAE, in Middle East, you will not be work as a consultant unless you have 3 years of experience after passing MRCP. 6 time, guys. You can write part 1 6 time. If you are done 6 time, that's it. You have to get a written application from your consultant, and then there is a long process like that. But you have 6 attempts. For the clinical places, no training required. You explained that, but you told that post 3 years. No. I have already explained that. Is it sure that part 1 is 6 attempts? Yes. Six attempts. Part 1, 6 attempts, guys. 6 attempts. Okay. We are already late. I'm going to move on further to our. Okay. Guys, we are already late. So please let me finish things early for you guys. Part 2 written, same thing like part 1, 2 exams, two papers, 100 question each. But the important thing, there will be more clinical investigations, CT scan, MRI, echocardiogram, ultrasound, audiogram, ECGs. There will be questions regarding long-term management, prognosis. This is what they will going to ask you about MRCP part 2. Exam format, same, exactly same, written as well as computer-based. Then the questions the question will be lengthy, guys. In part 2, part 1 questions are lengthy, but in part 2 question will be very lengthy. And they will be having photographs, pathology slides, inheritance tree, ECGs, X-rays, CT, MRI, echocardiogram, ultrasonography. C, the passing rate for MRCP Part 2 is more, 60 to 80%. Why? Because you have already passed the first step, which was the difficult one, Part 1. And your base is good. You are good to go for Part 2. The only thing you have to now study and focus more is on a bit of more depth in the management and the clinical diagnostic investigations. That's it, and you are good to go. So most of the candidates, they pass their MRCP Part 2 in first attempt after passing their MRCP Part 1, if they sit immediately after passing their MRCP Part 1. Passing marks are less, 454 out of 999. So it makes things better and easy for it. And in Part 2, the important thing is that there is no clinical basic sciences section. If you can see here, you can see that there is a basic science section, guys. Clinical science, you can see clinical science section. It will include immunology, anatomy, and genetics, things like that, epidemiology. But in Part 2, there is no basic science section. Everything will be clinical. Everything will be deeply clinical. So now, important thing, study resources, guys. There are a lot of study resources out there, guys. Notes, textbooks, question banks, past papers, crash courses, everything is out there. But what you have to study and what you have to go for, that is what I'm going to tell you right now. So guys, first of all, let me tell you that these notes, textbooks, these are only for the reference. If you are not able to understand things, the important thing in MRCP is that you should be able to revise your course as much as you can. At least 3 revisions are important for Part 1. Okay, depending upon the person's capability and their learning abilities. Okay, if you are a fast learner, that is a separate case. But let me tell you that textbooks are very lengthy. You cannot read them cover to cover, and you will not be able to reproduce these things. But there are few topics that you must read from the textbooks. There are few topics that you must read from certain notes out there. Okay, like there are certain topics which are written absolutely fantastically in certain notes. So you have to read those topics from those notes. But the basic and the far most important thing is the question bank. And which question bank? It is past medicine. For Part 1, past medicine is your Bible. Past medicine is your book of choice. You have to study past medicine. You have to study, you have to remember, you have to revise your past medicine at least twice. There are latest guidelines in past medicine. Please, please, please do not read the offline or PDF books of past medicine or question bank. They are outdated. They are outdated. Don't read it, because nice guidelines are changing with every passing month or 2 months. And the question that you will gonna get, it will be from the latest nice guidelines. So please, pass medicine. People will gonna tell you that you have to study on examination or pass test as well. But let me tell you guys, pass medicine is fine. You can read pass medicine, but again, the same thing. There are certain topics which you have to read from past test. You have to read past medicine completely, but there are certain topics you have to read from past test. Okay, then past papers, very important. Before going into the exam, you have to go to with the past papers, because it's very important. You will know that how the questions will gonna come in the exam. Crash courses, guys. What is the purpose of these crash courses that we are providing? So the most important purpose is that I will be the mentor. I will be mentoring you, and I have already been mentoring the candidates with ProMedics regarding MRCP Part 1. What is my job and role? My role is that I will gonna provide you with the best efficient notes. I will provide you, and I will gonna provide you with the recorded lectures from each and every subspecialty, from each and every topic of that subspecialty. And I'm gonna tell you that how the question will gonna come in the exam from that particular topic. The question that will gonna come, what catching points you will gonna have to look for, what question, what catching points, what important points you have to look for in that topic, and the rest, just read it. Don't waste your time. This is how you study smartly. Then I'm going to tell you that which topic you have to study from past medicine, which topic you have to study from past tests, and which topic you cannot afford to mix from notes. So guys, this is my role as a mentor in this crash course, which we will be providing. And I think you can if you know anyone, you can get the feedback from the one who have already done the crash courses with me. Anyways, so common questions regarding MRCP. After this, most of your queries will be resolved. So time required for preparation. So guys, it depends on person to person and your job. If you are working, I think, and your if you are a fast learner, maybe you require 3 months, at least 3 to 4 months minimum, up till 6 months, not more than 6 months, guys, not more than 6 months. Even the day before your exam, you will be doubting yourself that I don't know, I don't remember things, I have to delay, or I should postpone things. No, this is the nature of this exam. You will never ever be sure about this exam. So please study smartly for at least 3 to 4 months and go with your instinct and sit in the exam. Don't delay it too much. Training program essential to sit. I have already explained that. No passing marks. I have already told difficulty level. You can see in this graph. This graph has been taken from the Royal College Physician website, and you can see the passing rate for MRCP Part 1 is the lowest. Is the lowest, guys. It's because of the nature of the exam. This graph also describes the difficulty level, the performance rate report of candidates in part one. So you can see that you can see it later as well, that that out of 3914, only 4,666 candidates passed the exam, MRCP Part 1. And let me tell you that this passing percentage has also that number of candidates who have repeated their attempt, like who failed their attempt and now they have passed. So let me tell you that it will be less. Okay, how to pass in first attempt? The important thing is that study smartly. You should know what topic you have to study from where, which point in whole of this pharmacology, lengthy pharmacology, lengthy cardiology, I have to focus more on which topic, and in topic which points I have to focus more on. That's how things will gonna work, and that's how you will gonna pass your exam in first attempt. Plan your things smartly and study very, very wisely, guys. That's how you're gonna pass in your first attempt. And be very motivated. Don't doubt yourself. Don't ever doubt yourself. If you have planned to sit in this exam, just start preparing, go for the exam, and you will gonna pass. And the other important thing, let me tell you that I passed my both exams, part 1, part 2, written exam, while I was doing job. And especially in part 1, I was doing 2 jobs, guys. I was doing 2 jobs in my home country, and I was also studying for MRCP. So it's not difficult to do this thing with the exam if you study wisely. Okay, now I will be giving you a very concise overview of certain topics from pharmacology. Okay, uh, and I'm going to tell you that how I'm going to make things easy for you. How can I make things easy for you, and how you can study and you should study while studying for MRCP. Okay, guys, we will be discussing few topics from pharmacology, okay? And I'm going to tell you that if you are reading this topic and similarly all other topics from different specialties, I will be telling you that where you will have to focus more on. So first of all, let's go into ecstasy poisoning, guys. Ecstasy poisoning, what you have to remember in ecstasy poisoning, the first and the foremost thing that you have to remember in ecstasy poisoning is that it is an NMDA derivative. Amphetamines, these are amphetamines, okay? Second thing, clinical features. Let me tell you guys, maybe you will not, if someone among you have started preparing for exam, they will know what I'm telling you. But if you haven't, I will try to make things easy for you, because when you are studying for MRCP and you are studying topics from, for example, pharmacology and poisoning, you will see that most of them will have the similar presentations, but there will be certain one or two different things that will be there for every single topic. And that's what it will gonna help you differentiate and answer correctly in the exam. Because in the exam, you are already so tensed, stressed. The time is running fast, and you have to answer questions fastly to solve all the question in time. So under that pressure of time, you are not like, you cannot read the question again and again, single question again and again to answer that. No, you don't have that much time. You have to look for the catching points and then answer it straight away. So in excessive poisoning, what is important is that, first of all, you have to look that the patient will be tachycardic and the patient will be hypertensive. Agitation, anxiety, confusion, these things are all related to all other things as well. So guys, remember, hypertension, tachycardia, along with hyponatremia. See the things in red, hyperthermia and hyponatremia. Guys, ecstasy, someone presented to you with tachycardia, having high blood pressure, lab investigation shows hyponatremia, patient temperature is high, patient is having high temperature, maybe hyperthermia, maybe 38 point something, 39, something like that. So it is ecstasy poisoning. It is ecstasy poisoning. Then what will be the management? What you have to look? Remember that in ecstasy poisoning, there is no definitive antidote. Only management is supportive, guys. You can give intravenous fluid to the patient. If patient is hyperthermic, you can go for dantrolene, okay? And if the patient is paralyzed, you can go with ventilation, mechanical ventilation, okay? So guys, important thing in ecstasy, patient, these are amphetamines, patient will gonna present with hypertension, tachycardia, along with the signs of poisoning, which will be anxiety, which will be agitation, confusion, and there will be hyperthermia. Then opioid. What will you see in opioid? Heroin, opioid, like other. The important thing you have to remember is that in opioid poisoning, they will definitely gonna mention a patient is having pinpoint pupils and patient is having runny nose, watery eyes. Guys, these three things are really important to diagnose a patient with, because the question they will gonna give you is that, let me tell you, they will gonna give you a question that a patient, a guy this years of age has presented, was seen in altered sensorium or unconscious on the road, outside a pub or something like that. They will gonna make things difficult and confusing for you. They will gonna tell you that they will not gonna tell you a lot of things. They will gonna tell you only one, two, three things, and the rest will be the useless story. So what important thing they will gonna tell you? They will gonna tell you that he was brought in by the ambulance, and on examination, the patient has pinpoint pupil. This is a very common thing about opioid. So if you are lucky, they will gonna give you, but mostly they will not gonna give you pinpoint pupils, because pinpoint pupil, everyone knows opioid poisoning. Okay, so what they will gonna give you? They will gonna tell you that the patient is drowsy, patient has rhinorrhea and watery eyes. What can be the suspected poisoning? So guys, this is how you study. You should know that rhinorrhea and this watery eyes, heroin, opioid poisoning. Selective serotonin reuptake inhibitors, guys, these are random topics I have selected for you just to give you an overview that how you should study and how the questions will gonna come and how the exam is designed. Okay, so this topic will gonna make things better for you. Selective serotonin reuptake inhibitors, guys, they just in part one, they just love to ask you about different medications for different patients. They love to ask about adverse effects. They love to give scenario on adverse effects, a lot of things. So guys, selective serotonin reuptake inhibitors, first of all, remember, read the one in red. Sertraline is useful post myocardial infarction as there is more evidence for its safe use in this situation. Guys, they will gonna give you a scenario. They will gonna give you a scenario. A patient post myocardial infarction presented to you with chest pain. He underwent PCI. He is also a known case of depression. He is taking you want to prescribe him antidepressants. Guys, which medication is favorable for this patient? So guys, post myocardial infarction, the answer will be sertraline. This is how the question will gonna come. Then you can read in the next point that they have written that SSRI should be used with caution in children, and they have written fluoxetine is a drug of choice when an antidepressant is indicated. So this is how things gets confusing, because you have read that fluoxetine should be prescribed when you are prescribing or when it is indicated. So in the above scenario, which I have already told you, that a patient has post-myocardial infarction and you want to prescribe him anti-depressant or this SSRI, which one of the there will be the option of fluoxetine as well. So most of you will gonna select fluoxetine because you have read that fluoxetine is a drug of choice when antidepressant is indicated. But no, the patient is post-myocardial infarction. Patient underwent PCI. And now the only indicated SSRI is sertraline. This is how things get confusing in MRCP part 1. Then, what can be the adverse effects? The patient can have gastrointestinal bleeding. The patient can have gastrointestinal bleeding, guys. Okay? And it is a very, very common adverse effect. So you will always gonna prescribe the patient with proton pump inhibitor if you want to give NSAID. How the question will gonna come? They will gonna give you a scenario. A patient, a old age patient, she is a known case of osteoarthritis. She was taking paracetamol but not getting relief. She's also a known case of depression, and for that she is taking fluoxetine. Now the consultant had asked you to prescribe him an NSAID. Which of the following medication you will gonna prescribe? Okay, so guys, remember I told you they will gonna assess two, three topics in a single question. Here they will gonna assess your knowledge about osteoarthritis, that the patient was taking paracetamol, what medication you will gonna add next. Then they will gonna be assessing your knowledge on that patient is on SSRIs. So now how you will gonna change the prescription of the patient, because if you will gonna prescribe NSAID, patient will gonna bleed. So you have to add proton pump inhibitor here. In options, there will be multiple. It will be written NSAID, like name of any NSAID, maybe ibuprofen, something like that. Ibuprofen, paroxetine plus proton pump inhibitor, ibuprofen, paroxetine plus famotidine, something like that. So guys, this is how they will gonna ask you. They will assess you on multiple topics in a single question. Then they will gonna ask you, fluoxetine and paroxetine have higher propensity of drug interaction. They're gonna ask you the question like, a patient is being prescribed with SSRIs, but the doctor or the consultant has told you not to prescribe fluoxetine. Maybe the question will gonna come like this, or the question will gonna come that the consultant has asked you not to prescribe fluoxetine or paroxetine. Why? Or the question will gonna come, which of the following medication we will not gonna prescribe because of high drug interactions or higher proportion of drug interaction? Fluoxetine and paroxetine. One will be there, you have to select one. This is how you will be assessed in this topic. Then remember, hyponatremia associated with all type of antidepressant. You will gonna get a question that a patient of 65 years old, known case of depression, and to make it a bit confusing, they will gonna tell you that the patient recently, his dog died, or his cat, or her cat died, or her husband died, something like that, to make it confusing. And then they will gonna tell you that she is on fluoxetine or SSRIs, and now she, for the last few days, she has been confused. She has been confused. Which of the following is the possible reason? Depression, or new onset depression, or SSRIs, or there will be 2, 3 other options very closely related. So guys, you will gonna get confused that his cat has died, or his dog has died, and now, or his husband, or sorry, her husband has died. So what, maybe it is the new onset depression, or exacerbation of depression, something like that. But the answer will be that it is because of the SSRIs, because SSRIs cause hyponatremia, and hyponatremia will gonna lead to the confusion. So this is how they will gonna ask you question, guys. Next, very important, is QT prolongation. Citalopram and escitalopram, they're associated with QT prolongation on the ECG. What they will gonna tell you, a patient is a known case of depression. He recently had sore throat. He went to his GP, and his GP prescribed the medication. After taking the medication, the patient suddenly died. Which medication has been prescribed? So guys, what they are doing here, they are assessing you on multiple domains. For example, let me explain it to you. First of all, the patient was on SSRIs, citalopram, okay, and citalopram can cause QT prolongation, okay. Then she went to the GP, and GP prescribed him a medication, antibiotic, for her sore throat, which was most likely erythromycin or any drug, P54 drug inhibitor. What happened here is that P450 inhibitor has decreased the metabolism of citalopram and has increased the chances of QT prolongation, and the patient went into the VT, and patient died. So this is how they correlate things. Now this prolonged QT topic is from cardiology, okay, but they have asked you here, and they have asked you, and they have correlated the cardiology and pharmacology by pharmacology at the same time. 2 topics from pharmacology: drug inhibitors, P450 inhibitors, and the SSRIs. So this is how they ask question, guys. So you should be aware that what happened here, or what is happening here, what he is trying to ask me. So you have to be so smart that you have to correlate things. You have to correlate different topics. Now here, the patient was taking citalopram. Citalopram can cause QT prolongation. But what happened here? GP prescribed a medication which is a P450 inhibitors, which can be erythromycin, clarithromycin, okay, azithromycin, ciprofloxacin. That medication had inhibit the metabolism of citalopram. Citalopram, so the level of citalopram has gone high in the body, and because of that, QT prolongation happened. After the QT prolongation, patient went into the ventricular tachycardia, and patient died. This is what is MRCP. So similarly, interactions, same guys. NSAIDs with that. Heparin you cannot give, because heparin can cause what you call it, a tendency for bleeding. So you can see the red. NICE recommend avoiding SSRI and considering mirtazapine. A patient is a known, how you will gonna get the question? A patient is a known case of depression. She is taking fluoxetine for that, recently had a fall, or recently had chest pain, something like that. Echocardiography was done, and she was diagnosed with mitral stenosis. Mitral stenosis. Consultant has advised to start her own warfarin. What changes in medication you will gonna do in this patient's prescription? Guys, fluoxetine cannot be given with warfarin because it will gonna cause more chances of bleeding. That's why you have to change fluoxetine to mirtazapine. Guys, this is what they will gonna be asking you here. I hope that is clear and that makes sense. Okay. Next topic is I will gonna be going into like I will not be going into detail of it, but it's just a brief description. Like it is basically amidron-induced thyrotoxicosis, guys. It is amidron-induced thyrotoxicosis, and let me tell you that is a very important topic. Question will gonna come like in different ways for this topic. So this table is a very concise table to help you remember that how things will gonna work in amidron-induced thyrotoxicosis. So how the question will gonna come? First of all, they will gonna tell you that if you will gonna read this table in detail, you will gonna see that there is a difference. So this is how the question will gonna come. They will be saying that the patient has goiter and on color Doppler, the blood flow is high. Or they will gonna say that iodine uptake was high or normal. Which of the following type of thyrotoxicosis the patient is having? Type 1. Whereas if you can see in red, iodine 131 is normal or high uptake in type 1, whereas in type 2, it is minimal or low. At the same time, interleukin 6 level, a very important MCQs, is low or normal in type 1, whereas it is more in type 2 amidron-induced thyrotoxicosis. The other important MCQs you will gonna get from here is the management. In type 1, the management will be the same as of other thyrotoxicosis. But in type 2 thyrotoxicosis, you have to give steroids, guys. Steroids, corticosteroids. That's important. That is a misnomer that in thyrotoxicosis, you are giving steroids. So that type of confusing question they will gonna give you. They will gonna give you that the patient, they will gonna give you a long, what you can say that they will gonna give you a long, what can I say, a scenario, and they will gonna tell you that the patient has a midron, the patient is on, they will not gonna tell you that the patient is on a midron. They will gonna just tell you that the patient was having atrial fibrillation, and he was started on what you call it. He was started on a medication for a long period of time. Now he's taking medication, and suddenly his T3, T4 levels are high. Free T4 and TSH is low, and the iodine scan was done, and it showed minimal uptake. What will be your management? So the corticosteroids will be the management because it is thyroid amidron-induced thyrotoxicosis type 2. This is how you're going to get the questions from here, guys. Okay? Then, yeah, thank you. Okay, so what is the next thing? The next thing is that there is this one, what you call it, neuroleptic malignant syndrome, guys. In neuroleptic malignant syndrome, what is important for you guys to learn and to remember is that this is seen in patient taking antipsychotic medications, guys. Taking antipsychotic medication, okay? Or the other thing is that if a patient is Parkinson's, and he suddenly stops his dopaminergic drugs or reduce the dose, he will gonna go into neuroleptic malignant syndrome, guys. How the question will gonna come? Let me tell you how the question will gonna come. Okay. So the question that will gonna come is that, guys, a patient with Parkinson's disease deteriorates 1 to 2 days after admission to the hospital. What happened here? The patient's drug might have been changed, or the dose might have been changed, and after that the patient suddenly developed rigidity, pyrexia, and tachycardia. You can see that pyrexia, tachycardia, rigidity, everything is in every single thing, every single scenario. Okay, these are the common symptomatic signs which you will gonna get, but signs and symptoms. But here, what you have to remember in neuroleptic malignant syndrome is that the patient will be taking antipsychotic drugs, or the patient will be taking dopaminergic drug, and their dose might have been changed. That is the important thing that you have to remember. The other important thing is serotonin syndrome. In serotonin syndrome, sorry, and let me tell you that, remember here, in neuroleptic, you will gonna see rigidity, guys. In neuroleptic malignant syndrome, you will gonna see rigidity. Whereas in serotonin syndrome, what you will gonna see is that you will gonna see that there will be more tone in the muscles, okay, and the myoclonus will be there. Myoclonus is a very, very typical finding of serotonin syndrome, guys. Myoclonus is a jerk, which is very common with serotonin syndrome. So if a patient is taking selective serotonin reuptake inhibitors, and you have introduced monoamine oxidase inhibitor, or a patient has taken ecstasy or amphetamines, the patient will gonna go into serotonin syndrome. What is serotonin syndrome? The patient will gonna present to you with muscle increased tone in the muscle, along with myoclonus, guys. I'm very much focusing on this word myoclonus, because in the scenarios, you will gonna be confused between either it is malignant syndrome or it is serotonin syndrome, but the catching point will be myoclonus, guys. Stop the serotonin medication and use benzodiazepine for agitation, and for you can consider ciprofloxacin as well. This is the, what you call it, the difference between neuroleptic malignant syndrome and serotonin syndrome, guys. It will gonna develop over days to week, whereas serotonin syndrome will gonna develop immediately within 1 day. Then I have told you, in neuroleptic there will be rigidity, whereas here in serotonin it will be tremors, hyperreflexia, and myoclonus, guys. Don't forget this word, myoclonus. It is in serotonin syndrome. Okay, so now, guys, I have taken these questions from past papers regarding the topics I have just taught you here right now, and I'm going to give you the questions, and please try to respond it. Please try to respond. Tell the answer. What can be the answer? And I will gonna tell you that the way I have taught you these topics, how things will gonna be so easy for you to pick up after just focusing on. And remember, I haven't taken all of the topic from, I have only shown you some important points that you should be focusing on in these slides. Otherwise, when you will gonna start reading about these things, they are a bit lengthy, so you will not be able to remember that what I have to remember or what I have to focus more on. So this is how you focus more on the important things. And now I'm going to show you that how studying smartly with focusing on important things will gonna help you solve the questions easily. So guys, read this thing. You are called to see a 18 years old girl who told her parents that she partied all night and took 5 ecstasy tablets. The most recent tablets were ingested 6 hours ago. On examination, she is restless, dehydrated, and her blood pressure is 100/60, and her pulse is 100 per minute. What will be your next management step? Gastric lavage, intravenous fluid, intubation, and provocation of vomiting or sedation. So guys, what will be your answer? Give me your answers, please. Excellent. It's B. It's B, guys. Intubation, it's B. So guys, it's B, intravenous fluid. I told you that there is a sportive management for ecstasy poisoning. Remember, ecstasy poisoning, sportive management. Okay. You have to support the patient, give IV fluids to the patient. That's how you can go with that. Okay. Next question, guys. A 17-year-old girl is admitted from her birthday party. She does not normally drink alcohol, but you understand she was given some by a friend, along with a pill to loosen up and have fun. On examination, GCS is 14, blood pressure is 155 by 95, and pulse is 125. Her respiratory rate is 24. Pupils are dilated. Which one of the following best explains her clinical features? Diclofenac, ecstasy, morphine, thyroxine, verapamil. Ecstasy. Excellent. So guys, see here, patient is having hypertension, patient is tachycardic, and high respiratory rate. Okay. And pill to loosen up is always ecstasy. This is what it is. This is what it is, guys. Hyperthermia, hypertension, and euphoric state. Next question, guys. A 40 years old bank clerk has been receiving, mute yourself, please, mute yourself, has been receiving phenelzine for severe depression under the care of psychiatry team. She is brought to the emergency department in an agitated state with high fever, tremors, and agitation. Her partner says that 1 week earlier, on out of the RGP, he was prescribed an additional medication to address her worsening low mood. Which of the following is most likely to have provoked the adverse reaction? Fluoxetine, isocarboxide, lithium, St. John's wort. Okay. Okay, we have an option B, C, A. So guys, what actually is happening here? Can someone tell me what actually is happening here? Exactly. Excellent, guys. Excellent. Guys, phenelzine is a monoamine oxidase inhibitor. And I have already told you that you cannot give SSRIs along with this monoamine oxidase inhibitor. It will gonna take the patient and it will gonna make patients suffer from serotonin syndrome. This is how the question will gonna come. And these are only few examples, guys. And I have chosen easy examples from past papers. So to help you guys understand things easily and to actually boost up your confidence that you understood things. But let me tell you that in further, if you're going to read about MRCP, things will be a bit more, the scenarios will be a bit more lengthy, okay? And there will be a bit more confusing statement in the scenario, in the STEM, which will going to make you inclined toward other options as well. But you guys are doing great, great. It is fluoxetine because monoamine oxidase inhibitors and SSRIs you cannot give together, and it will gonna increase the serotonin. It will gonna leading to the serotonin syndrome. So hyperthermia, tremors, muscle rigidity, and myoclonus. Guys, don't forget this word myoclonus. Okay, so a 62-year-old man is brought by a friend who found him collapsed. In his pocket, you find a card from psychiatry outpatient department along with a full box of haloperidol. On examination, his temperature is 38.9 and he is alert but not responsive to command. He has widespread muscle rigidity. Which of the following is the most likely diagnosis, guys? Excellent. Neuroleptic malignant syndrome. Why? The patient is on haloperidol, antipsychotic medications, and he has developed hyperthermia, muscle rigidity, neuroleptic malignant syndrome. Guys, right now I have taught you these particular topics, and at the same time I'm giving you the questions from the same topic. So that's why things are more easy for you. But remember, just imagine if on the exam day, you are getting questions from all around the world, from psychiatry, from everywhere, like you don't know from where the question is coming from. So you have to have these important catching points in your mind. Okay. And remember, this bacterial meningitis, catatonic schizophrenia, and cerebral malaria, Remember, these options are out of, like, they are 180-degree different from the neuroleptic malignant syndrome. But let me tell you, in the STEM, they will gonna give you certain things to make you confuse about bacterial meningitis or schizophrenia. They might be, they will gonna tell you that the patient is now hearing something. The patient is having some hallucination, something, or he recently traveled to Africa, to make you confuse between cerebral malaria, haloperidol overdose, something like that. So this is how, guys, things are. Okay. So neuroleptic malignant syndrome, we have already read about that. Okay, guys. You are asked to review a 63 years old man as a medical registrar on duty. He is currently an inpatient on a psychiatry ward and receiving treatment for severe depression. The psychiatry team has considered a potential diagnosis of serotonin syndrome. Which of the following feature most strongly suggestive of serotonin syndrome, guys? Tell me. Flaccid pulses, heart rate, myoclonus, profuse sweating, temperature. Excellent. Myoclonus, guys. Myoclonus, serotonin syndrome. Just print it in your brain. Imprint it in your brain. Myoclonus, guys. Very typical of serotonin syndrome. Okay. Thank you so much for your time. Thank you so much for everything. Now the floor is open for you guys to ask questions and to give your feedback. You are most welcome. Guys, please ask questions or give your feedbacks. And if you have any question, just ask those things so that we will be wrapping up this session. And guys, anything regarding the course or anything regarding these sessions or all these things, please ask the admin. I'm gonna give you the number for the admin in the chat box, and you can drop them a text, and they will gonna give you detail of each and everything. So in my sessions, what I usually do is that every day we are doing certain topics, like for example, cardiology. It's a lengthy topic. We're gonna divide it, and then we're gonna do each and every topic, and I'm going to tell you that this is how the question from this thing will gonna come. This topic, you will have to focus on this thing. Okay, and then we will be doing past test. We will be doing past test in our coming session, because we have I have already recorded all my lectures, and those are uploaded on our official website. And this time we will be doing the questions from past tests, from past medicines, the questions which are important to make you guys feel very confident in yourself, so that you can easily pick up the important points immediately whenever a question will gonna come there, and it will be a great uh success for you guys. Okay, any question, guys, or I will be wrapping up the session now.
Excellent, excellent presentation, doctor. Stay blessed and happy. Thank you so much.
Thank you so much for your positive feedback. Negative feedbacks are also more than welcome. And thank you all for bearing with me. I know it was a very long ride, and every one of you must be having some, what you call it, commitments. So great. Thank you, guys. Thank you so much. Thank you so much, very much. You are most welcome. For PLAB, OET should be most recent, like 2-3 months. Is there any requirement for MRCP if you want to go to the UK? Guys, OET is required to book PLAB 1. Okay. But if your OET is expired, you can still sit in PLAB 2, but before GMC registration, your OET should be valid. You have to take OET again. Otherwise, you will not be able to get registered with the GMC. So plan your journey like that. Once you have given OET, immediately, like for example, every year, GMC is releasing seats. So at least go for your, what you call it, the OET 2-3 months before the release of seats, so that you can immediately book PLAB 1, and then you have time to go for PLAB 2, and at the end you still have time for your GMC registration before your OET is expired, because every exam is very expensive nowadays. So please what you call it, plan yourself and plan your journey. Okay, plan your journey. That's how. For MRCP, you don't need OET. But if you will be going to UK for work after GMC, like for getting GMC registration, you need OET. Do we need to take past medicine and past tests after taking your classes? Guys, past medicine, we will be providing you with that. And past test, you don't need to take any subscription for past test. That thing is very expensive. If you want to take subscription, I will recommend you to take subscription for past medicine only and only. That's it. No need for past test. We will be providing you with the past test. Okay. Or is this enough to take your subscription that will include all the material? We will be here to help you in every way possible, giving you material, helping you with the course, helping you with preparation, and conducting regular sessions along with the recordings available for all the topics from cardiology to endocrinology to hematology to basic sciences, every single thing. We have already uploaded that on our sites, and I was the mentor for that as well, and I have taken those classes, and now you will be having access 24/7 to those lectures, and at the same time there will be live sessions regarding the queries, the topic that you are confused about, and at the same time live sessions from every topic of past medicine and past test. I hope that makes sense. Okay, guys, any other question, or we will be concluding the session now? I think you don't have any questions, so I will be wrapping up the session. So guys, stay blessed. Very, very best of luck to you for your future endeavors, for your journey. And I wish you all the best. And remember me in your prayers as well. And stay blessed. Take care, guys. Bye-bye.